my Trini Total Health family, and welcome to another vlog on Trini Total Health with your nurse and entrepreneur Adriana. So guys, as you can see, I'm organizing for work. It's the next day, of course. I'm packing my bag. This is my hygiene bag. As you can see, I have some feminine wipes. I'm adding it to the pouch. So I have like stuff like deodorant, wipes. I also have a comb, a brush, gel, my toothpaste and toothbrush, anything that I personally may need. I also have like feminine pads, everything. So I add that in my bag, my work bag. I always ensure to check that every day when I'm going to work to make sure I have everything. If I need to top up on anything, I add it. I also add my pinafore, so that is protecting my uniform when I'm on work. Right, so that's come like my covering for my uniform. And I also carry my neck pillow. Now as you can see, neck pillow, I will carry that more for the night shift. For the day shift, I will not walk with that because who has time to really get that kind of rest? But for the night shift, I definitely walk with my neck pillow. So my bag is all set. Spray a little perfume to get rid of that funky smell so you could be smelling good on work, y'all. We know the hospital has a lot of odors. So yeah, and now I'm adding my water to my water bottle to really just ensure that I have water for work. I always do this because sometimes the filter on work may not have any water, so I always be prepared with water. So even if I don't carry, sometimes I don't even carry food, but I will make sure that I always have water to drink. Okay guys, so now I'm on the board. I'm actually checking the DDA cupboard and the DDA drug books to ensure that everything corresponds, all addition was made correct, and everything is all set with the medication for the patient's use. This is something that a nurse would always have to check every shift. When you reach on your shift, you check your DDA cupboard and you make sure everything is all well and good. Then after that, we'll definitely have to take over our patients. So the nurse from the other shift will actually give over to us, and you would be in charge of the patients for your shift. Everybody is assigned a certain amount of patients. Each institution is different, so I'm not even going to go down in that road, but you will be in charge of amount of patients to see for your shift. Right, so here I'm actually taking over the notes. I already checked all my patients, and now is to take over the notes and ensure that everything is good with the notes as well, and start to prepare for later in the night. Okay, so it's approximately minutes to 4 in the morning. So right now I'm actually organizing the medication to pass the medication for 5 a.m. Some are for 5 and some are for 6, but majority are for 5 a.m. So I'm actually preparing for that right now. So this is the IV medication that I'm about to actually prepare for the patients. I check the IV access first to ensure that it's patent and working, and I also check the medication chart and the doctor's notes to ensure that the medication was prescribed and the medication wasn't given before, right? But this is normally be TDS drugs that are given 3 times for the day. Some are OD drugs. It depends on the time that the patient was actually admitted or the drug was administered, we keep that within those lines, right? So as you can see there, I'm breaking vials there for Lasix. Lasix is also known as furosemide. It's a loop diuretic, so it helps those who have renal impairment and hypertension to really get rid of the fluid. Right, so I'm actually drawing that up there. This patient needed to get 40 milligrams, so one vial of Lasix or furosemide is actually 20 milligrams, so two vials will be 40 milligrams. So I'm doing that there. So this patient definitely needs to get 40 milligram, and when giving Lasix, always remember to observe the map. You want to make sure that the map is equal or greater than 65 in order to give the patient that medication. Alright, so now I'm dealing with antibiotics. This is Zosyn that this patient is going to get right now. Right, so the other name for Zosyn is piperacillin tazobactam. Right, and it comes in 4.5 grams. Some patients are on 2.5, some patients are on 4.5, but this patient in particular is actually on 2.5 grams. And what is happening, because it's 4.5 grams, we actually mix it with 20 mils of normal saline or water for injection. Then we draw up 10 mils, which is half of the dosage. So the other half will be placed in the fridge and it can be used within the 24 hours. So obviously most of the times patients who are on Zosyn, they are on that regime for 3 times a day. So by the time lunchtime, that next dose that is in the fridge for that patient, the other nurse would actually be given that. So you make sure you label it, put the date, put the time that you open it, and place it in the fridge, and ensure when you're giving over to the next nurse, let them know that it has medication in the fridge for the patient, right? So now I'm actually organizing IV fluid, intravenous fluid. This patient is on a IV fluid regime of 3 liters in 24 hours of normal saline. So definitely we need to ensure that the patients get their fluids, especially if they're dehydrated, if they have low blood pressure, if it is their electrolytes are imbalanced. They definitely need to get their fluids. So I have to ensure that the patient gets a liter on my shift and a liter on the next shift and a liter in the other shift. So that's how you average the amounts of fluids, right? Hi my Trini Total Health family, and welcome to another day in the vlog. Happy Tuesday. So I'm getting ready for my second night shift. I already showered, just gonna get dressed and get out of the house. Y'all, last night I did, as you saw in the video clip before this, I didn't really get much of a break because we were a bit short staffed. I got to eat something, but not to say like take a full break, and that happens a lot sometimes in the hospital where nurses work, because it's really short staffed and you can't just leave your patients unattended. So I really didn't get a full break, and plus I didn't get to really take my hour lunch or yeah, like my hour lunch to really take a little nap, to just close my eyes. I didn't even get that chance. So when I came home, I slept straight through till this evening. So I'm feeling a lot better now as I sleep, but I know tomorrow morning it's going to be the same thing again. So I'm getting ready. Don't have much to do really. Today I would be the floating nurse. So as a floating nurse, I'll be assisting on the both sides where it's needed, doing the intravenous medication and the admissions, plus the sensors, updating the book, helping on the both sides. Wherever they need my help, I'll be there. So it will be a lot easier on me tonight. Hopefully the staff come out to work. So yeah guys, let me organize and I'll talk to you guys when I get back. Okay guys, so let's organize this medication to serve now. So right now the patient has to get Rocaffin and they are on 2 grams. So Rocaffin is also known as ceftriaxone. It comes in 1,000 milligram or 1 gram. So if the patient has to get 2 grams, that means the patient has to get 2 vials, right? So Rocaffin is mixed with normal saline as well as water for injection. So either one can be used. So I'm using some normal saline. I'm using 10 mils to mix the Rocaffin. I'm using 10 mils in one vial, 10 mils in the next vial. And usually we put the 2 grams in a Buretrol, fill it up to 100, and that's how you start to give your patient the Rocaffin medication. So yeah, normally when I go to the patient bed, I make sure and assess the IV access first before I actually mix the drug, because this is a stock drug and you don't want to just mix it just so before checking the patient's IV access. So I normally go to the IV access by the patient and ensure that it's patent and working, it's not tissuing, and they don't have phlebitis or anything like that. And then I would actually mix it and administer one time. So as this is a stock drug, we usually have to ensure that when we administer this Rocaffin, there's a stock drug book that we need to enter the patient's information and the dosage, as well as the doctor's name, my name, from administering that drug. So we also have some more Lasix again to give, also known as furosemide. So I have a few vials actually mixed because these patients actually could get them because their MAP is greater than 65 and their blood pressure is elevated as well, and they are also renal patients. So I'm just here organizing the vials as I go. Okay guys, so I also gather any other medication. So there are patients who has to get Clexane or enoxaparin sodium injections. These are anticoagulants to help prevent any clots from traveling anywhere throughout the body, especially patients who are bedridden and cannot walk like us, who are able to walk around and do things for ourselves. They are normally prescribed on Clexane to prevent any clots from traveling to their lungs, their heart, their brain, or anywhere in their body. So again, I have some 1 here, so just observe while I prepare the medication. Okay, my Trini family. So now we have Venofer, also known as iron sucrose. So this is given to patients who are anemic or who have long-term kidney disease and on dialysis. So patients normally get Venofer every 2 weeks, right, or twice weekly, I should say, right? So this patient is getting 200 milligrams in 200 mils normal saline, right? So Venofer is easily stained on your clothes, so I'm very careful when I'm pulling up this medication to not get it stained on my white uniform and anywhere on the surface and all of that. So I'll pull this up. I would inject it into a saline bag that I release some of the IV fluids and the air, so the patient will actually get the 200 milligram and 200 mils normal saline. So yeah guys, I prepare it with an IV line and I prime the line, everything with the medication. So I'm back home from work. I'm not naked, I'm in my towel, but I am so tired, guys. Yo, last night was so much. Like, we was already short staff, and it was a lot. It was a lot. So I'm really tired. But guys, did you actually notice on Instagram it had a particular nurse that fell asleep after her shift. She worked a 12-hour shift in America, right? And where the parking lot is, where the nurses have to park, she fell asleep with the car on reverse. Guys, that woman damaged herself. She got some broken bones. She's alive today, but that is so risky, and it shows that the nursing environment, or nurses on the whole, are exhausted, really exhausted. So we have to take care of ourselves. So that's why I said, like, after my night shift, I usually come home, I cool out my feet before I shower, I take my shower, and I take a rest. I sleep straight until the evening for when I have to go back for my second night. Guys, we just had to really take it easy. So I want to end this vlog here because I wanted it to just be about a nurse getting prepared for night shift. It don't normally be like this all the time. Certain days are different to some, but this is how it is most of the times. So if it is you guys enjoyed today's vlog, feel free to like, comment, and subscribe to my channel. Turn on your post notifications so you won't miss any time that I'm posting. And I'll see you guys in the next one. Bye.